Hi again, everyone, and this is Dr. R covering another epidemiologic question. So again, start with the lead in. Can I answer this question? What type of study design is this? The answer is no. I'm going to need to go up to the question stem. I will also take a look at the question answer options here, and I will look at case control. So these are different types of study designs. So let's go back up to the question stem and just dive right in. A group of researchers is interested in determining the prevalence. Oh, there's a nice word for you. So let's talk about prevalence really quick. So prevalence is a very important discussion to have for epidemiology, because remember that epidemiology can often be defined as what is in the numerator, which population, what kind of risk factors, what kind of exposures, and which is in the denominator, what is the total population, what kind of exposure do they have. And so when we're looking at prevalence, we're actually talking about the total that have the disease in the population, or all cases, divided by the total number that are in the population, and all of these are at a specific time. So remember, number that have the disease in that population and the total number of people in that population. That is the prevalence. So let's contrast incidence. Incidence is those who develop the disease, or these are called new cases. So anybody that gets a new case divided by the number that are at risk of getting this new case, this disease. So let's look at that. Here it's total population at one given time. Here it's the number of people that are at risk of getting that disease, which is a different population. This is a subset of a total population. And here, this is the number of new cases versus the total number of people that have the disease at a specific time period. And this is found new cases at a specific time, and then those are at risk during that same specific time. So this can happen over periods of time. This usually happens at one specific time. So this is over time, specific time, new cases, number of people who have the disease, the total population, and those who are at risk. All right, so let's keep that in mind when we're talking about this. So when we're talking about prevalence, it is a number with the disease at a specific time divided by the total population, right? So that is prevalence. So determining the prevalence of hypertension among middle-aged adults in a particular community. So this particular community is going to be what? Right, that's going to be the total population. They collect data from a random sample of 1,000 individuals, age 40 to 60 years old, and record their blood pressure measurements. So what kind of study do you think this is? So, a case control study. Well, a case control study starts with cases, and then we actually choose controls, those who don't have the disease. So cases, they have the disease, and those who do not have the disease. And often what you find in case controls is that the numbers are the same. There'll be 500 cases and there'll be 500 controls, or 1,000 cases or 1,000 controls. That's not what we're seeing here. We are looking for the prevalence, and then we are collecting data from a random sample of 1,000 individuals. Okay? So this is also done usually retrospectively. What does that mean? Well, retrospectively means that the data was collected here. This is where we collected the data. And this is where we currently are at in time, so that we are looking backwards in time at the data, retrospective. If we look forward in time, that is called prospective, right? All right, so that is a case control. We are not doing a case control here. A cohort study. So a cohort study is really looking at a group of individuals who are initially free of the disease, so they don't have the disease, and we are following them over time, and we are trying to determine the incidence. Why the incidence? Remember what incidence was? The number of new cases divided by those at risk, right? So in a cohort study, what we are looking at is we are following them over time. They didn't have the disease here. And then as we go along, oops, one ends up getting the disease. Another one ends up getting the disease. And so these actually become our new cases, right? So these are new cases. And then what we're looking at is the population that is at risk, right? Well, guess what? The people that were in this part of the study are the ones that are at risk. So these people become the denominator. So the people that become new cases are here in the study and become the numerator, and the total people that were at risk are the denominator. So that is a cohort study. Cohort study. Is that what we saw here? No, we did not start with people and then we did not follow them over time. So that is not the correct one. A crossover study. So a crossover does this. We have two groups. One gets the exposure, one does not get the exposure. So I'm just going to call that the placebo group. And then we collect data on them and we follow them over time. And then what we end up doing is if we gave them a drug, what we're going to want to know is that the drug leaves their system before they cross over. So we are going to have a washout period where we are going to allow the drug to leave their system. And then what we're going to do is we are going to then cross them over. And now the people that did get the exposure now get the placebo, and the people that got the placebo now get the exposure. And then we're going to collect data on them, and we are going to compare these two sets of data. So, is that happening here? No, that is not happening here. Cross-sectional study. Well, cross-sectional studies are at one single point in time. Can't spell today, y'all, sorry. So at one single point in time, so if we look at time, and it's going this way, we are going to be looking at one single point in time, and all of our data is going to be collected there. Is that what we're doing? Yes, that is what we're doing. They collected data from a random sample of 1,000 people from 40 to 60 years old and recorded their blood pressure measurements. That is happening at a single point in time. And the important thing about prevalence or cross-sectional studies is we want to look at prevalence. And the reason why is because we want to look at the number of people have the disease, right, divided by the total population at that specific time. So we wanted to look at their blood pressure measurements to determine hypertension. So how many of them actually were diagnosed with hypertension at a specific time, and then we would use 1,000 for the total population. So how many fit the disease or hypertension would go in the numerator, and 1,000 would go in the denominator. Randomized controlled trial. Are we randomizing these people to two different groups? The drug group and the placebo group. I know I mixed them up here, sorry, but so we did not randomize these 1,000 people, so an RCT doesn't fit here either.